All right, that's hard to follow. Thank you. So everybody, we're about to talk about something really exciting and a little overwhelming, so I want you to take a psychological breath. All right, here we go. On our marks, get set. This talk I'm about to give you guys, I usually take about 45 minutes. We're going to do it in 20. And so instead of just throwing numbers and letters out at you, everybody's got something to follow along and draw on and scribble on and take their stress out on your table. Medicare has been around since about 1965, and through the last 60 years or so, has gone through a lot of different iterations. But we're going to talk about what it is today. When we talk about original Medicare, we're talking about what we sign up through the Social Security Administration, Parts A and B. That's up at the top. And then you get your little red, white, and blue paper card. I don't know why they think that paper is a good idea for Social Security card and Medicare cards. So we hold on to it. And Part A, we've been paying in our whole working lives. As long as you've worked 10 years and you've been paying into Medicare, Part A is $0 per month. It's going to cover your hospital bills. So you're going to pay a $1,676 deductible when you go to the hospital, and then you're covered. Part B, that's going to cover our medical, doctor bills, therapies, things like that. And that's, this year, most people pay $185 a month for Part B. Part B, you'll have a tiny little $256 deductible, and then 80% of the bills are covered, so you're on the hook for 20%. 20% adds up, and there is no ceiling for this. So when we're working, if we are on group coverage, we're used to our networks, deductibles, and a max out of pocket. So for somebody like me who's paying for a high deductible plan, we've got, I think it's like $13,000 family max out of pocket. Hope I don't have a year like that, but if I do, I know there's a ceiling. With original Medicare, there's not. So how do we protect ourselves financially? So that's where we're going to go down to the bottom. There are two options: Medicare Supplement, also known as Medigap, because, you know, we can't just have one term, we have to add in more. And then we've got Medicare Advantage plans. So we've got Part A and Part B with the government. Part C is also known as Medicare Advantage. And Part D, D for drugs, is our medication coverage, because Medicare, original Medicare, does not cover medications. All these different letters, different things you're going to be thinking about, can get really overwhelming. When you turn 65 is when you think, okay, this is when I'm going to start thinking about all this. Raise your hand if you're helping out a family member with this. Yeah, that's not what you signed up for. So working with a broker to kind of help guide through these things is going to be your key. It never costs anything to work with a broker, so find somebody that you know, like, and trust to help walk you through this so that you don't have to carry this burden on yourself. So Part A, Part B, original Medicare. Medigap, Medicare Supplement, those are going to be plans. Plan A, Plan B, Plan C, all the way to Plan N, because again, can't just be simple parts versus plans. There's a difference. Medigap is going to cover the deductible for Part A and the copay for Part B. So depending on the plan, you could be spending anywhere from $60 a month to $180 a month or more, depending on your age, if you smoke. Men, you guys are more expensive than us women. You're making up for it because we've been more expensive with all our clothes and hair and makeup and all that. On the medical side, you guys are more expensive. So depending on what it is, you're going to pay a premium every month. Just like our home and our auto, we're using it whether we're paying for it, whether we use it or not, right? You don't have to worry about networks. If your hospital medical doctor system takes Medicare, you're in. No referrals, no networks, things like that. There are starting to be some prior authorizations needed, and that's coming from Medicare. They're trying to reduce the fraud, waste, and abuse that's happening. So they're putting it on us, even though we're not, well, sorry.
Opinion.
Then you're going to need a separate Plan D, Part D, Part D. D for drugs. Now this can range anywhere from $0 a month to $154 a month, depending on what are your medications. Have you been paying attention to price increases? And if not, work with a broker. I'm saving somebody $1,300 next year because their price increase went up. They weren't going to look at it, but I went, hey, let's just take a look. It'll take 5 minutes. $0 a month. We're not allowed to say free, but I can say $0 a month. But your medications and how they're covered. I've got a client. They're on some medications. We put it in there. Their plan options are $0 a month and $124 a month. Which plan did they choose?
0.
They chose the $124 a month plan because of the way their medication was covered. Once you put in all that information, you're looking at what is my cost over the entire year, not just for the premium, but how is the medication covered too? So the $0 a month plan, first of all, they may not have covered all of the medication. And if they did, it was at a higher copay or coinsurance than the other plan. So if I look at the entire year, it was cheaper to go on a plan that cost $124 a month. Who designed this? As an educator, I used to be a middle school science teacher. My job is to get all the information and then be the messenger. Don't kill me. My job is to make sure that you get those aha moments so that you can make these decisions for you, for your family members, in a really empowered way. All right, so that's Medigap. That's the red section. Medigap plus a Plan D, Part D. Now, raise your hand if you work for or have had experience with home health care facilities or skilled nursing. They love Original Medicare. They love Original Medicare with a supplement. Medicare pays better, they pay quicker. So why don't we go that? Why doesn't everybody go that way? Well, maybe they can't afford the monthly premium on top of the $185 a month. And that's okay. In the Denver metro area, there are a lot of medical systems and hospitals that we're working with, that we've got great networks. It's when the skilled nursing and the home health industry come in, that's where the hiccups go. And I wish I had better answers for you. I got great conversations coming up with some great professionals to kind of figure out how I, as a professional, can help you navigate that as a consumer. So the blue side, Medicare Advantage plans. This is what all the advertisements are about, the mailers in your mailbox. If your phone is ringing off the hook, you gotta go to donotcall.gov and get your phone registered so that your calls lessen. They're not gonna stop. The bad guys are always gonna call. Doesn't matter. But they can lessen. So Medicare Advantage plans work similar to the way we're used to with our group plans. They have a network that you have to navigate within. If it's an HMO, you have to stay within the little box. If it's a PPO, you can maybe go outside of the box as long as the provider is willing to bill as an out-of-network provider. So it gives you more flexibility, but not the full flexibility of Original Medicare. With these plans, they are either $0 a month, remember I can't say free, or there's a small premium depending on the plan. And depending on the plan, as long as your doctors and your medications are covered, that's the most important thing. Then you've got things like Part D, So your medication is covered, and the extra benefits. Shout out some of those extra benefits that are always out there on the commercials. Vision and dental. Health, yep, fitness. There's a lot of them. What's that? Grocery money. Do I qualify for $3,000 a year in grocery money? No. That's the short answer. The more complicated answer is, I don't know, it depends. What's your health like? Are you on Medicaid? I don't know. Let's talk. So the Part C, Medicare Advantage plans, you do have to stay within network. Depending on the company, depending on the plan, there might be some referrals needed. There's going to be prior authorizations needed. There's going to be the network that you have to stay inside of. There are some networks that are really, really small, but their copays are also small. It is how companies help them save money, and then they pass some of those savings on to you as well. So copays, usually $0 to see your primary care physician. And if you're going to a place like Archwell, raise your hand, Archwell. Okay, they're out there. Then you can go see them, $0. If you go to a specialist, anywhere from $15 to $45 or more. To stay in a hospital, let's say anywhere from $275 to $450 a day for days 1 through 5 or 6 or 7, depending on the plan, right? And so you use it, you pay for it as you need it. And for the, so it's like a buffet. And we're all just enjoying all these things like vision and dental and fitness and food and things like that. And it sounds very tempting. And it is. Depending on where you live, it can be an amazing option. But what if you want to go to a place like the Mayo Clinic or Johns Hopkins or MD Anderson? Well, they don't take Medicare Advantage plans. So original Medicare is the way to go. What would happen if you said, oh, I now need to go into skilled nursing. I'm just going to drop my Advantage plan and go on to original Medicare because I want to make sure I can go anywhere I want. I don't want to be boxed in. Depends on your situation, whether it's a bad idea or a horrible idea. And the reason I say it that way is because, remember, with original Medicare, there's no max out of pocket. And it's not unusual to see or hear about a $1 million medical event. You fall, you go to the hospital, you get surgery, you get healed, you go into skilled nursing, and on, and therapy and rehab, and there's always something. I love the technology that's come out of the medical industry. My father-in-law has been around at least 13 years longer than we ever expected because he has a heart condition, a lung condition. He's taking these medications that are $8,000 a month. But he's here, right? So if you go on original Medicare and you have no max out of pocket, that can be financially scary. However, it does give you the flexibility. Now, can you go back onto a Medicare Advantage plan? Yeah, you totally can in January. So if you have a medical event in March and you need to go into skilled nursing, you're going to have to wait 9 months before you can go back on a plan to cover yourself financially. Wait, can't I just get a Medicare supplement? If you want to go on a supplement, or if you're on this supplement, you're paying this much and you want to look for a lower bill, you have to go through medical underwriting. So if you've had a hospital stay in the last 6 months, if you've had a cancer diagnosis in the last 2 years, you're not going to pass. And so your options get more limited. When we're 65, we're not using our Medicare, our health care, the way an 80-year-old is. And that's kind of what's happening in the United States right now. We've been talking about 10,000 people turning 65 every single day. Well, now they're turning 80. I don't know if it's 10,000 people are turning 80, but there's a lot of people turning 80 now. And so the amount of money that we're using to pay for all the care is going up. It's costing the companies money. So they're lowering costs. They're changing those extra benefits. They're changing the co-pays. They're raising the price. The price of a Medicare supplement, the average year-over-year increase this coming year is going to be 48%. Ouch.
Yeah.
Yeah.
Yeah, okay, ready? Everybody ready? Thank you, Lisa. Thank you. Yeah. The other thing is people were putting off all their elective surgeries during COVID, so now they're using them. So there's just a lot of stuff going on, and then we're not going to get into the political landscape of it all as well. The good news about all of this is we live in an area that has amazing health opportunities. Colorado is one of the, or if it maybe it is, the healthiest state in America, right? Our obesity rates are low, our cholesterol rates, diabetes, all those things are better than anywhere else in the country. That's the great news. And the other great news is working with a broker like me or anybody else that you know, like, and trust doesn't cost you anything. We get paid by the carriers. So you want to find somebody who is not boxed in. You're calling an 800 number. You don't know who they're contracted with, if they're going to give you the best number, and work with someone local. So my mom and dad live in Michigan, and my mom-in-law and father-in-law live in New Mexico, and I've got an aunt in Arizona, and they're like, oh, we're going to help you out. We're going to help build your business. Here, you can work with us. And I'm so appreciative. But right now, I'm a little stressed out because when I look at their plans, I'm like, I don't know if that plan, which looks good on paper, is really going to, when rubber hits the road, is that going to be the right one for you? So I'm actually sending my aunt to a local broker. You need somebody who you know, like, and trust that knows the market where you live or your loved one lives. Okay, so to wrap up, parts A, B, C, and D. Plan A, B, C, D, all the way to N. Having flexibility with monthly premiums or networks with 0 monthly premium but co-pays. As long as it fits within your health needs, you're going to be covered. And I've got time for 2 or 3 questions. Can't be too specific. Yes, ma'am.
So I am on a Medicare Advantage Extra plan. Heard that?
I've not heard of the extra. Okay. Okay. Medicare Advantage Extra for those who didn't hear. Okay.
And it does have, the health club, and she signed me into the extra. I had been into the Advantage, and then now it's an extra plan last year, so it's called extra. And the only extra I thought I was getting was dental, which was 1 year was $750, but now I've got up to $2,500 worth of dental coverage, right? So what happens if you don't know about this extra program? Does that just go away if I don't use it?
Usually, if you don't use it, you lose those extra benefits. Yeah. So if you've got any dental needs this year, get them done. Or actually, you've got more money next year, maybe you wait. Yeah. Working with somebody who really does know the ins and outs, you can interview all of us. I just had a conversation yesterday where I did a plan review, and he's like, all right, great, thank you for that information. I'm going to go talk to my agent over here and let him know what you said. You're welcome. But that's what we do. All right. One last question.
If someone moves into assisted living, does that start open enrollment, and for how long?
Yes, so opportunities to sign up are things like moving either into a new community, a new county, new state. And so yes,